Welcome to Different Roots Radio, where we discuss business, lifestyle, and social issues. This episode with Dr. Umear Ahmed, one of the three physicians from Juvida Clinic Hair Transplant Centre, we discuss entrepreneurial pursuits outside of one's educational journey, wives' tales regarding hair growth or the lack thereof, and some well-known celebrities and their fading hairlines. So without further ado, like, subscribe, and share while enjoying this episode.
This week on Different Roots Radio, we are joined by Dr. Umear Ahmed from Juvida Clinics, which is a hair transplant centre. We're very excited to have him. Thank you for joining us today, Dr. Ahmed. We're wondering, please tell us a bit more about Juvida Hair Transplant Centre and really when did it start and when did it start and what was the really reason and motivation behind it?
Sure. So I'm one of the doctors that works at Juvida. So I'm not actually one of the owners. So the owners, two guys. Background is that they're both dentists. They studied together at Leeds University and had been very, very close friends sort of during their degree program and afterwards as well. Many dentists are generally quite entrepreneurial people, aren't they? So they had the idea. They saw that sort of hair transplants were becoming a little bit more popular as the years went on, and they thought about exploring that as a possible new venture. So around 5 years ago, Juvida opened its doors. So it's based in North Yorkshire. When it opened, it was one of just a few hair transplant clinics in the UK. There are many more since sort of the last 5 years since they've opened. A few more have also opened their doors. But I know that they haven't spoken to them at length at sort of their vision and their ethos and things. The initial idea behind opening the clinic was, I think there was a lot of sort of, people trying to get into hair transplant clinics, trying to almost make a quick buck. And there's often a real sort of sales mentality in terms of trying to get people in, trying to get people to have hair transplants. Whereas I think the owners of Juvida have a slightly different approach. So it's very much a patient-centered approach, making sure that patients are at the very center of all the sort of decisions that are made, trying to make the whole process from the initial consultation when a patient first books in to have a chat about their concerns, all the way through to booking in for a transplant, having the transplant, and all the aftercare. So I think their vision was to maybe do things a little bit differently, not to have a sales approach, and to offer sort of a great service from beginning to end, and making it very much a patient-centered approach.
And how big is the clinic right now? How many doctors work in that space?
Yeah. So all together, there's 3 doctors, but the way we work, we all work different days. So we always try and do just one patient per day. So I'll do sort of 2 to 3 days a week. There's another doctor that does a couple of days a week, and there's another doctor that does sort of the odd day here and there. Because we're sort of also split across the main clinic, which is in Yorkshire, North Yorkshire, and then we've also got other sort of satellite clinics in Newcastle in the northeast and also in London. So all in all, there's 3 of us.
Oh, wow. So to have, how does one go about like even setting up satellite offices, or do you guys all have to like drive out there to Newcastle and then,
So I'm from Newcastle, so that's why there's one clinic in Newcastle, because it's easy for me and less sort of travel time. So I do Newcastle. We've got one guy who's from London who does London, and then the other guy. So I do Yorkshire and Newcastle, and I try to travel. And then the other guy's from Manchester, so he's pretty close to North Yorkshire. So he covers that area as well.
That's a very interesting approach. It's funny you said dentists are quite entrepreneurial. I hadn't really heard that. I worked in healthcare before, and I know that doctors, some of them are, but most of them, because they're so smart and so focused on medicine, they don't really have time to be entrepreneurial. But do you find dentists are quite interested in starting their own businesses and trying different things?
I think even more so, it's like to be a dentist and then say, I have a great idea for something that's not in teeth, but in a different field altogether. Yeah. It's like I know doctors that go into specialization and they make clinics based on their own specialization, but to then say, I'm a dentist, and let me even take an abstract idea, is like, I'm a doctor, but yet I want to go make slippers or something like that. And
Yeah.
I'm like, that's so weird. But no. But I guess these dentists are, thinking outside the box and not looking inside gums all the time. They're like, oh, there's more to the person's teeth.
Exactly. Yeah, exactly. I know. So yeah, they're very driven guys, very enthusiastic. They give 110% that into the world of hair transplant surgery. So so they're really enthusiastic. And yeah, I agree. I think I'm not sure why that is, but yeah, all the dentists I know, they all have that entrepreneurial spirit. And doctors are a bit of a mixed bag. So some of us do, but I agree. Most are just sort of happy doing their normal hospital-based jobs or working in GP practices and just concentrating on patient care and not really thinking about other ways of making money and other sort of avenues and things to explore.
So, quickly between you and me, were these guys kind of starting to have receding hairline or something? That's why the idea started popping in the head, or is it like?
But you guys need to see these two guys. They have like the thickest, most fullest hair you've ever seen in your life.
Oh yeah,
they should do.
Yeah, crazy, crazy.
No excuses.
It's like being a personal trainer and being insanely overweight. Everyone's like, I don't want that.
Or the worst thing is to be like, I never trust a skinny chef, man. It's like,
yeah, exactly. You're not even trying your food.
Absolutely. So I got into hair transplant surgery partly because actually it started off me being concerned about my hair. So since I was sort of in my late teens, my hair's been sort of thinning. It's not significant. I've not got significant hair loss, but it's been thinning really since my late teens. So we're talking about sort of 17, 18 years. And so it all started off by me trying to find out, well, what can I do to try and minimize my hair loss? I started looking into treatments and what was available. I found out early on that really I'm not a great candidate for hair transplant, but I started to think, well, actually, okay, I don't need a hair transplant, but maybe I can do hair transplants. And that's how I eventually got into this as my new career, which was around 2 to 3 years ago. So I joined Juvida 2 years ago. So still sort of, they were only in existence for about 3 years. But the last couple of years, the company's just massively grown. From when I first got there, sort of the numbers of people in the team have more than doubled. So we've got, more than one patient coordinator now. There's several hair technicians who are the people that assist with the hair surgery. There's 3 doctors, and there's a whole sort of admin team in the background as well. So the company's really grown to the point where now we're sort of doing, medical procedures. We're doing the transplants 5 days a week, and we've got a waiting list of sort of 4 or 5 months now. So so things are really sort of taken off. So it's really good.
Are you socially distancing with these hair transplants? I mean, how does that affect you? Do you have to wear them because it's on the head, so you can't really avoid the whole...
You can use like a really long pole to just insert each single hair.
No, see, I need someone to be paying attention if it's my head. They can't be stretching out with gloves on and everything. You need to get right in there, be precise. So
yeah, well, we always wear masks anyway. So even before COVID, we're wearing masks for the whole duration of the procedure anyways. And sometimes and a degree of sort of visor, sort of face coverings, not just the face mask, but also over the eyes. And yeah, so we're still open because there's an organization called the CQC, the organization that kind of
Care
monitors.
Quality Commission.
Yeah, Care Quality Commission. That's it.
You have a good rating. I checked your CQC rating before. Yeah. I had to do my due diligence.
Oh wow!
We're allowed to stay open. So yes, we're still open. We're still doing.
Doctor, real quick. So, how did you get to the level of being a specialization in hair? Like, do you go through medical school, then specialize, or is it like a different platform you got to go through?
Yeah, so the normal process is, so you do medical school, which in the UK, it's normally 5 years. Sometimes some universities do it for 6 years. After that, everyone does what we call the foundation program, which is 2 years of being a junior doctor. So everyone does that. You normally do sort of 4 monthly jobs over a 2-year period. And then after that, you can you specialize in whatever you want. So if you want to be a GP, you do GP. If you want to be an orthopedic surgeon, you do orthopedic surgery. If you want to be a hospital doctor, like a cardiologist, then you'll do general medicine, and you choose your specialty. Now, there is no specialty for hair restoration surgery or hair surgery. It doesn't exist. So all the surgeons that are in the UK that do hair transplants are other forms of doctors who have decided to go away and do some extra training in hair transplant surgery, and then that's them sort of specialized in that sort of discipline. But there is no specific training program, whereas all the other sort of specialties, you have a proper fixed training program that lasts X number of years. you have a professional body, you have exams that you've got to sit. So hair transplant surgery is a little bit different in that all hair transplant surgeons in the UK, of course, they're all doctors, but from varying backgrounds. So from different disciplines and different specialties, really.
Okay. I mean, I know hair loss is an issue that every man worries about. We're not all affected by it, but I think, well, to be honest,
Speak for yourself.
I know. To be fair, I mean, I have a luscious long
You've
locks.
got a great head of hair.
I mean, I've seen Snoop Dogg and he has dreadlocks down to his back, and he's about 60, 70. So I don't know. Some people, I guess, don't worry about it.
I mean, Snoop Lion with
Snoop
a
Lion
lion mane.
with the mane. Yeah. I think that most guys worry about it. If they don't worry about hair loss, you worry about going grey. And I'm one of these people. I only have like a couple of grey hairs, but I pluck them out because they're annoying. So I looked for a quiz, found some questions. So I thought I'd ask Dami some questions.
Is that quiz time?
It's quiz time. I'll ask Dami some questions. He can let us all know whether he thinks these are true or false, and then you can give us the correct answer or back up Dami because he's probably going to be right.
All right, I believe that. That's faith.
So first question. This is actually from my cousin because he's been trying to grow a beard for his whole life. And is it true that if you shave, your beard, your facial hair grows back faster? And is it also the same for your hair? If you cut your hair a lot, will it grow back faster?
You know, this is kind of like, I gotta give a little story to this.
Story time.
Because like, when I was younger and I heard this whole like, oh yeah, you gotta shave often to get a beard. And then what happened when I was growing up was like, it just grew like the goatee area and it didn't go for the sides. So then I was like, I kept shaving, nothing. All there was like just little sprinkles of hair.
Tufts of
so
hair.
then, because I'm a dog guy, and then I had a dog and I felt like, you know, this dog gives me some licks on the side of my face. And I felt like that motivated hair growth. So I had my dog lick me on my face every now and then. Be like, it helped. Well, well, look at me now. Look, I got a nice beard.
Nice beard, though.
Yeah, it's a nice beard. It connects and everything. Does yours connect?
Kind of.
Okay.
Maybe this is the beginning of a new scientific breakthrough. That dog saliva maybe has some potential for
You heard it here first.
Maybe you need to patent it or something. You need to, take it to the next level.
We didn't pay this doctor. He came of his own free will. Doctor supported.
So, is it true that if you shave more, it will make your hair grow faster?
So, as far as I'm aware, it's an old wives' tale. A very strongly and widely held belief, as far as I know. Even so, I'm from a South Asian background, and so whenever a baby is born, we always shave the head like 2 or 3 times. Some people keep on doing it because they want the baby to end up having, like a full head of hair by the time they're a few months or something. So yeah, it's a really strongly held belief, but there is no research behind it as far as I'm aware. I have looked into it before in the past. The research isn't there to support that. So the answer is no.
Oh, wow. All that time wasted shaving and cutting my face for I still got a beard.
FYI, I didn't actually say it was true or false. I didn't. So I'm technically correct. And I've, by defaulting on
we're going to give you a
answer.
non-applicable on that one.
All right.
Next question. Does race or ethnicity affect hair loss?
I'm genetically speaking, I would say that some races have a higher affinity to stress, and stress can be a trigger for hair loss. So
is that a fact?
It's what I believe I've read somewhere in a scientific journal.
That's an extra point. Yes. That's right.
Yes. So I would not be surprised if there's a little bit of a correlation, but it might not make it that let's say all Asian people lose their hair kind of thing. It maybe there's like a 60% chance that they might, versus white people that might have like 40% chance that they might lose hair.
It's a very political answer.
Yes, thank you. I was raised in a political home. So.
Well, I can't. That's not even a true or false, is it?
So sorry. True.
So does race affect? It does. Okay. So does race or ethnicity have an effect on baldness?
Yes, it does. Yeah. So yeah. Yeah. So I mean, all races are no race is exempt from hair loss. Obviously, it transcends all races and ethnicities. But actually, if you look at the data, it's actually white Caucasian men that are more likely and more prone to suffering with hair loss. So they have the higher rates when you compare whites, particularly from whites to Black Afro-Caribbean. And then actually, you're talking about Asians. I don't know if you mean Asian as in, Far East and Oriental, or South Indian, or
I
what,
generalized it. I didn't want to,
Yeah. So actually, well, yeah. If we generalize it, then actually Asians have the lowest incidence of hair loss. So white Caucasians are the highest, and then Black Afro-Caribbean in the middle, and then actually Asians actually the lowest.
Hey, black don't crack. Neither does yellow either.
Yes. We're winning. Okay, this is good news for us. Is there a link between, okay, this is for me. Is there a link between gray hair and hair loss? Because I've got a lot of hair and a few of them are gray, but I don't have hair loss. And my dad has a lot of hair, but quite a lot of it's gray. So is there a correlation? You
must know that the motto is no stress, man. You just got to have less stress in your life.
Hakuna Matata.
Hakuna Matata. It means no worries. I'm going to break out into song. But I would say, I think when people's hair turn gray, it really means like the pigment in the hair is not as strong. So it probably means, it's like dying follicles. So there's chance that, the higher gray hair you have, the more chance your hair will fall out. That's my own understanding. So true. Long story short,
there is a correlation, you believe. I personally don't think there is a correlation.
Well, I hope your hair falls out.
Why would you say something like that?
At a ripe old age of tomorrow.
Such a hater. Is there a correlation between hair loss and going gray?
Yeah, so it's really not that clear, and I'm not sure if I can give you a true or a false. What it looks like is that the two are sort of independent in that obviously you can have gray hair but still have a really good head of gray hair. You can obviously lose your hair and not have a single gray hair. So they're independent from that perspective. Both have genetic components to them. Is it possible that some of the same genes are involved in causing gray hair and causing hair loss? It's possible, but it's not very clear cut. So it's sort of sitting on the fence on that one.
True and false. So I'm right.
Yeah.
We're both right because I said false and you said true. So
okay.
Team different roots got that one right.
Different roots. All right. So you're telling me one could be a silver fox and remain a silver fox without becoming, a bold white guy?
Absolutely. Yeah, for sure.
Big bald and big gray
and gray streaks. Yeah, man.
Yeah, cool.
Silver fox. Like who?
Morgan Freeman.
Morgan Freeman.
No.
Yes, Morgan Freeman. Yes, Morgan Freeman. The voice of God.
The voice of God, exactly. That's not bad. Not too shabby. Okay, this I don't actually know this one. Is there? Can you use when you get a hair transplant? Do you use someone else's hair or do you use your own hair? Like when you have liposuction, they take some fat out of your thighs or your butt and they put it wherever. I don't know.
Liposuction is the removal of
so,
fat, but when they transplant it to another body place.
Yeah. So with hair, is it your hair or is it other people's hair? I'm going to assume it's other people's hair.
Yeah.
Because if you've got no hair, then
yeah. I'm going to say depends on, and I'm going to give another political answer. Depends on who the individual is. Like, let's say they do have nice, healthy hair roots somewhere else that they can grab from, maybe. But if that's not a possibility, then they'll definitely use probably from other people, other animals. I'm not sure.
Animals? Ooh.
Yeah, I would not be surprised.
That's a double question. Can you also use animal hair? Okay.
For the animal, I don't think it's ever been tried, as far as I'm aware.
Yeah, so you're telling me people who have like long ass hair like horses, it's not real horse hair. That's those
are weaves though. They don't count.
Oh,
yeah, because that's not getting transplanted into the scalp. So that's like like as an extension or something. So it's always going to be your own hair. It's always going to be your own hair. So when you have a hair transplant, you get the hair from what we call the donor area. So around the back of your head. So even if you're bald, right, you always have some hair on the back of the head. Yeah. So around the back and a little bit around the sides, that hair will always be there. It doesn't matter how bald you are, you're always going to have some hair around the back. So you can take some of that hair. You can't take all of it because then obviously that area will be bald as well. But you can take like maybe 40, 50% of that area around the back of the head, the donor area, without you actually realizing that it's gone almost. I know that sounds a bit strange, but yeah, so that's the donor area, and that's where we always get the hair from. If someone needs a lot of hair and there isn't much going around in the back, or they need a very large transplant and we're running out of hair around the back, then you can also, not ideal, but you can also take hair from elsewhere. So that's normally either the beard, it can also be the chest, the back, and other such places. But it's always going to be your hair. And the reason for that is because if you try to transplant and use donor hairs from another person. Two issues really. The first thing is that unless you have like jet black hair, it's going to be noticeable that it's not your hair. So the thickness of the hair, the color of the hair, it's always going to be not quite the same. So that'll be one potential issue. The second issue is that actually the body's going to know that it's not yours. And what it means is the body's immune system, it's going to reject it. It's going to recognize that it's a foreign substance, that it's a foreign tissue. It's not going to accept it. So what that would mean is, so when someone has like a liver transplant or has a kidney transplant, these people, they have to go on lifelong immunosuppressants, medications to suppress the immune system in order for the body to not reject the organ. And I think that would probably be, one step too much for an aesthetic, for a hair transplant, to go on lifelong medications to in order to get someone else's hair that probably isn't going to match your hair.
So the only universal donor you can ever get is yourself. That's really it.
Okay. And final question. Why is it that, or is it true that only men can go bald?
It depends. I mean, when you talk about baldness, if you're talking about like where you go completely bald and you've got nothing left on the top of your head and only a little bit around the back of the sides, then generally speaking, that's a male problem, male pattern baldness. Women can get hair loss. So it depends on what you mean by baldness, but certainly women can suffer with hair loss. But the hair loss is a bit different. So with a man, normally you're talking about hair being, the frontal hairline starts to recede into the temporal areas, sometimes over the crown. And that's the pattern of male pattern baldness. Whereas for females, it doesn't normally present that way. You get more of a diffuse hair loss. So you'll get generalized hair thinning, and it just becomes a bit weaker and what have you. But you wouldn't normally expect, proper full hair loss unless it's because of a medical condition. If it's like they're on chemotherapy medications or they've got suffering with something called alopecia, which is an immune disorder. So aside from that, normal sort of hair thinning in women would be more of a diffuse pattern, whereas in men, it's more of a sort of receding and hair loss around the crown.
Wow. Interesting. Well, Dami brought up something interesting about, he said, stress affects baldness. I mean, that's what a lot of people hear. And also if you're stressed, you get gray hair, but I heard that was a myth. But does stress affect baldness and gray hair? And also, in these times of high stress with everyone being locked down and COVID, is that just going to make everyone go bald? Like next year and the year after, that we're going to see a lot more bald and grey haired people because a whole generation's just been stressed out for 2020. Because I feel like I've got a grey hair here and I got one there and one in my beard, in my moustache, all just from this year of lockdowns. Like before that, in January, they weren't there. That's a fact. That's a fact. So yeah,
COVID is causing havoc, isn't it, in every way, shape, and form. So in terms of hair loss and stress, and COVID as well. So stress can cause hair loss. That's for sure. That's clear cut. There's lots of research to show that. So I don't want to make it too scientific, but there is a condition called telogen effluvium. So the hair, you've got
of course, I knew
that. That's with a capital T, right? Yes, I knew that.
Yeah. So the hair goes through like a hair cycle, and what can sometimes happen, because of stress, is that the follicles, which is like the seed of a hair, the follicles, which most follicles in your head will be in what we call a growth phase, which is called anagen phase. And so it's in the anagen phase. And what can happen with stress is that temporarily the follicles can get shifted from one part of the cycle, the anagen phase, to the telogen phase. And that basically causes excessive hair shedding. So you get hair loss, excessive hair shedding. And so that can be noticeable, more hair being sort of shed in the shower when you're brushing it and all those sorts of things. And that can be precipitated by stress. Can be precipitated by sort of severe disease and illness, pregnancy, and even COVID. So any significant illness, high fever temperatures, any significant illness can sometimes cause this issue, this thing called telogen effluvium. It normally presents a few months after, maybe 1, 2, 3 months after the stress starting or after the illness. But the good news is most of the time, sort of as the months pass by, those follicles that were in the shedding phase normally revert back to the growth phase. So normally it's just a temporary issue and a temporary thing. So if you take away the stress and obviously you take away the COVID, the illness or whatever it is, then things should just go back to normal.
So you hear that? So we just got to wait for 2020 to end, and then things should go back to normal.
Exactly.
And your grey hair won't exist.
Yeah, exactly. You'll just book some holidays.
Yeah.
Well,
January 1st, you'll just see.
January 1st, you're on holiday. As soon we're not in lockdown.
Yeah.
If they announce a new lockdown, then I don't know. It might have another 3 months of.
Take your pictures now.
And so, does COVID actually affect hair loss or?
Yeah, so I mean, I think the thing to say with COVID was we're still really learning, aren't we? It's obviously a new illness that's really played havoc in so many ways. And one of the things that we're still learning about particularly is long COVID. So some of the longer term manifestations and complications that are sort of residual symptoms that some people still suffer with. And so if we're talking about hair loss, yes, it can cause hair loss, but it causes this thing called telogen effluvium. So it's not something that's specific to COVID. Any sort of severe illness or any sort of illness where you get high temperature can cause this condition. But I think the key thing to remember is that it should very much be a temporary thing. So yes, it can cause excessive hair shedding for maybe a period of a few months, but then things should revert back to normal.
Thank you very much for letting us know the truths and myths behind hair loss and all things that will allow us to not stress out so much and what we can do to kind of avoid potential hair loss. But right now we want to give you the opportunity to give us 1 minute of advice, words of wisdom that you'll be able to share for people that would be able to follow into your footsteps.
If anyone's out there that is thinking about maybe getting into aesthetics, of course, I'm in hair transplant surgery, but I guess hair transplant surgery is part of more of aesthetics and cosmetics. Then it's not just restricted to doctors in terms of setting clinics up. Of course, you've got to be a doctor in order to undertake hair transplant surgery, but as I said, that the clinic is owned by dentists. So anyone that has sort of ambitions, don't feel like you can only keep going in your current career and you can't sort of explore outside the box. So if you are interested, there's so many opportunities. There's lots of courses in aesthetics that you can sort of read about and get involved with. And more specifically, if you're a doctor, then lots of courses that you can attend on facial aesthetics. And we're going to be hopefully starting our own program where we'll be hopefully training hopefully doctors in hair transplant surgery. So that opportunity should be arising very, very soon.
Thank you very much, Dr. Ahmed, for joining us and your words of wisdom. I was wondering though.
Are you talking about this rumor you heard?
It is. I'm a big basketball fan, and everyone knows. And I like LeBron James, the LA Lakers.
LeBron James.
And he's people make fun. There are a lot of memes that he's been going bald for the last 10 years. Or so.
Is it that sliding headband?
Exactly. And he was playing basketball, and everyone saying he was bald. Then suddenly he came back with like a full head of hair. So I was like, oh, that's nice. And then he was playing basketball. He had his headband, and then he got a bit hot, so he pushed his headband back. But then his hair went back with the hairband, so it kind of was like a rug, and it kind of folded and creased. And then one of his teammates pointed and said, "LeBron, your hair." And so then he pulled it down, and essentially he was wearing a toupee, yes. But it was obviously glued on. But when he pushed his head back, the whole thing moved back. So are there a lot of celebrities? That was a bit obvious. Same with
he should have gone to Juvida.
He should have gone to Juvida. That would have stayed there. He wouldn't have to have this glue-on wig. But Wayne Rooney, I hear he had hair transplant therapy, and his hair came out quite well for him. So do you see a lot of celebrities, and is it a lot more common than we think, since a lot of guys do go bald?
Yeah, I mean, look, about 80% of males will have issues with hair loss at some point in their life. So it's a very common issue, very common problem. And now that the cost of hair transplants have come down, it's for the everyday person. It's not just specific for celebrities. Of course, there are some celebrities that have had it done, but the costs are now that actually most people can afford a hair transplant. So
celebrities such as, I'm sure you guys have, if you can give us some dirty secrets.
A couple of names, dots.
Well, we've had a couple of people that so we've had a Britain's Got Talent winner. So George Sampson was a case that we did. We've had various people from Strictly Come Dancing to Britain's Got Talent to XFactor. We've had quite a few sort of celebrities that are from TV reality shows, but most of them we can't name because we don't want to break confidentiality. So we can't do that. But
I knew they were too beautiful to be natural anyway. So.
But I think the key thing is that, I mean, yes, we get some celebrities, but it doesn't matter who we get. Everyone gets treated the same way. It's not that we give certain people VIP treatment. So hopefully we'll do our very best, and we're always dedicated and provide the same service for everyone, whether or not they're famous or not.
You got some good reviews, so seem to be doing a good job. Thank you very much for joining us today, Dr. Ahmed. We're wondering if you could quickly give us ideas of how we can reach you. People, 80% of the men out there, guys, I hope you're listening. We all need this. Hopefully I won't anytime soon, but if you want to get in touch with your clinic, get a consultation. I don't know if you guys are doing Zoom calls because of lockdown, but tell us how to reach you and the clinic.
Sure, yeah. So we offer free consultations. So anyone that has any concerns with regards to hair loss, it's a great opportunity, get bespoke advice. It's not just hair transplants that we offer. So there's other options in terms of trying to prevent hair loss through something called plasma treatment, through medications. So any concerns you have with hair loss, you just get in touch. You can follow us on Instagram at Juvida Clinics. There's a Facebook page, there's a YouTube channel, or just go to the website, which is juvidaclinics.com. Give us a call and we can organize either remote consultation appointments or also face-to-face. So we look forward to seeing some of you guys soon.
Yeah, great. So thanks a lot. I really appreciate that. And I may not reach out to you, but I'm sure 80% of people will.
We're in that upper echelon, 20%.
Yes. So remember, it's whites, blacks, Asians. So it's likely Asians are also in that 20%.
Oh, that's true.
Yeah,
so what of our Caucasian listeners, get over there.
Those white men.
Everyone get over there. Look, we make jokes now. In like 6 months, this could be a very different
2020 is not over.
2020 is not over. We could end up bald by the end of the year.
Or zombie apocalypse could happen.
Exactly. Then no one cares about hair. So thank you very much for your time. Everyone get in touch and have a great evening. Thanks for joining us.
Thank you, guys. Thanks very much.
All right. See you guys.
Cheers. Thank you.
Peace.
Don't forget to like, subscribe, and share our talks. And we will talk to you next week. One love.
Peace.